Hey, Alphanurses, I'm Licensure from alphanurseguy.com. This is 30 practice NCLEX questions. Without delay, let's get started.
The nurse is teaching a client and his family about the client's new diagnosis of hemochromatosis. Which of the following details should the nurse include? 1. Hemochromatosis is an autoimmune disorder that affects the HFE gene. 2. Individuals who are heterozygous for hemochromatosis rarely develop the disease. 3. Individuals who are homozygous for hemochromatosis are carriers of hemochromatosis. 4. Men are at greater risk for hemochromatosis. The correct answer is 2. The nurse should teach the client and family that individuals who are heterozygous for hemochromatosis rarely develop the disease. Men and women are equally at risk for hemochromatosis, but men are diagnosed earlier because women do not usually have manifestations until menopause. Hemochromatosis is the most common genetic disorder in Canada and the United States. Individuals who are homozygous for hemochromatosis receive a defective gene from each parent. Those with homozygous genes may develop the disease. The emergency department nurse should question which healthcare provider prescription when providing care for an older adult with a fracture of the left ulna. 1. Get x-rays of the left forearm. 2. Give him a Paradine IM for pain. 3. Monitor vital signs every hour. 4. Elevate left arm on pillows. The correct answer is 2. Give him a Paradine IM for pain. Meperidine should not be used because of its toxic metabolites that can cause seizures and other adverse drug events, especially in the older adult population. X-rays are used to confirm the diagnosis. Vital signs and elevation are common actions for a patient in the emergency department, and elevation can decrease the swelling in the affected extremity.
The elderly client diagnosed with coronary artery disease has been taking aspirin daily for more than a year. Which data warrants notifying the HCP? 1. The client has lost 5 pounds in the last month. 2. The client has trouble hearing low tones. 3. The client reports having a funny taste in the mouth. 4. The client has hard, dark, tarry stools. The correct answer is 4. The client has hard, dark, tarry stools. A complication of long-term aspirin use is gastric bleeding, which could result in dark, tarry stools. This data would warrant further intervention. Which assessment data warrants immediate intervention for the client in labor who is receiving an oxytocin infusion via pump? 1. The uterus periodically becomes hard and firm. 2. The client reports an urgency to void. 3. The client denies the urge to push. 4. The fetal heart rate does not return to baseline. The correct answer is 4. The fetal heart rate does not return to baseline. During a contraction, the fetal heart rate will decrease, but should return to the baseline fetal heart rate after the contraction. If this does not occur, it indicates the infant is in distress, and this warrants immediate intervention. This could also be a sign of uterine rupture resulting from overstimulation of the uterus. The oxytocin infusion should be stopped immediately. The uterus becoming hard and firm periodically indicates a contraction, which is expected when administering a uterine stimulant. The client wanting to urinate would be expected because the baby's head is pushing against the bladder. Denying the urge to push indicates the client is not in the last stages of labor. The nurse is discussing the neonatal blood screening test with a new mother. The nurse knows that the teaching was successful when the mother states that the test screens for the presence in the newborn of which of the following diseases? Select all that apply. 1. Hypothyroidism. 2. Sickle cell disease. 3. Galactosemia. 4. Cerebral palsy. 5. Cystic fibrosis. The correct answers are 1. Hypothyroidism, 2. Sickle cell disease, 3. Galactosemia, and 5. Cystic fibrosis. Congenital hypothyroidism is a malfunction of or complete absence of the thyroid gland that is present from birth. It is screened for in all 50 states. Sickle cell disease is an autosomal recessive disease resulting in abnormally shaped red blood cells. It is screened for in all 50 states. Galactosemia is an incurable autosomal recessive disease characterized by the absence of the enzyme required to metabolize galactose. It is screened for in all 50 states. Cystic fibrosis is an autosomal recessive illness characterized by the presence of thick mucus in many organ systems, most notably the respiratory tract. It is screened for in all 50 states. Cerebral palsy is a disorder characterized by motor dysfunction resulting from a non-progressive injury to brain tissue. The injury may occur during pregnancy, labor, delivery, or shortly after delivery. Physical examination is required to diagnose cerebral palsy. Blood screening is not an appropriate means of diagnosis. It is important to realize that neonatal screening is state-specific. Each state determines which diseases will be screened for. In March 1915, the Advisory Committee on Heritable Disorders in Newborns and Children recommended that all newborns be screened for 32 core disorders and 26 secondary disorders. Unfortunately, many states screen for far fewer disorders. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The parent of a child with cystic fibrosis is excited about the possibility of the child receiving a double lung transplant. What should the parent understand? 1. The transplant will cure the child of CF and allow the child to lead a long and healthy life. 2. The transplant will not cure the child of CF, but will allow the child to have a longer life. 3. The transplant will help to reverse the multisystem damage that has been caused by CF. 4. The transplant will be the child's only chance at surviving long enough to graduate from college. The correct answer is 2. The transplant will not cure the child of CF, but will allow the child to have a longer life. If the child were not taking enzymes, the result would be a large amount of undigested food, azoturia, and steatorrhea in the stool. Pancreatic ducts in CF clients become clogged with thick mucus that blocks the flow of digestive enzymes from the pancreas to the duodenum. Therefore, clients must take digestive enzymes with all meals and snacks to aid in absorption of nutrients. Often, teens are non-compliant with their medication regimen because they want to be like their peers. A 2-year-old has just been diagnosed with cystic fibrosis. The parents ask the nurse what early respiratory symptoms they should expect to see in their child. Which is the nurse's best response? 1. You can expect your child to develop a barrel-shaped chest. 2. You can expect your child to develop a chronic productive cough. 3. You can expect your child to develop bronchiectasis. 4. You can expect your child to develop wheezing respirations. The correct answer is 4. You can expect your child to develop wheezing respirations. Wheezing respirations and a dry, non-productive cough are common early symptoms in CF. Answer 2 can be eliminated because of the word chronic. Chronic implies that the disease process is advanced rather than in the initial stages. Answers 1 and 3 can be eliminated if you know of the signs and symptoms of advanced lung disease. The parent of a child with cystic fibrosis asks the nurse what will be done to relieve the child's constipation. Which is the nurse's best response? 1. Your child likely has an obstruction and will require surgery. 2. Your child will likely be given IV fluids. 3. Your child will likely be given Miralax. 4. Your child will be placed on a clear liquid diet. The correct answer is 3. Your child will likely be given Miralax. CF clients with constipation commonly receive a stool softener or an osmotic solution, such as Miralax orally, to relieve their constipation. Answers 1 and 2 can be eliminated because surgery and IV fluids are not indicated for constipation. The parents of a 5-week-old have just been told that their child has cystic fibrosis. The mother had a sister who died of CF when she was 19 years of age. The parents are sad and ask the nurse about their child's projected life expectancy. What is the nurse's best response? 1. The life expectancy for CF patients has improved significantly in recent years. 2. Your child might not follow the same course that the mother's sister did. 3. The healthcare provider will come to speak to you about treatment options. 4. The nurse answers their questions briefly, listens to their concerns, and is available later after they've processed the information. The correct answer is 4. The nurse answers their questions briefly, listens to their concerns, and is available later after they've processed the information. The nurse's best intervention is to listen as the parents express their concerns and fears. The nurse's answers should be brief, knowing that the parents are not able to process information right now. The nurse should be available later if the parents have any other concerns or questions, or if they just need someone with whom to talk. A patient is asked to participate in a medical research study. Which document should the nurse explain to the patient because it protects the patient's rights? 1. Code of Ethics. 2. Informed Consent. 3. Nurse Practice Act. 4. Constitution of the United States. The correct answer is 2. Informed Consent. Informed consent is an agreement by a person to accept a course of treatment or a procedure after receiving complete information necessary to make a knowledgeable decision. Nurse Practice Acts define the scope of nursing practice. They are unrelated to participation in research studies. The client is prescribed silver sulfadiazine for a partial thickness burn to the back. Which information should the nurse discuss concerning this medication? 1. Encourage the client to drink 3,000 milliliters of water. 2. Discuss the need to eat foods high in protein. 3. Teach the client how to test the urine for ketones. 4. Instruct the client to change the dressing twice a day. The correct answer is 1. Encourage the client to drink 3,000 milliliters of water. Silver sulfadiazine is a sulfonamide antibacterial agent. The client should drink large amounts of fluids to prevent sulfa crystals from forming in the urine. The client should eat foods high in protein for healing purposes, but this does not specifically concern this medication. Ketones are a byproduct of fat breakdown and would not be specific for teaching about silver sulfadiazine. The client should change the dressing twice a day, but this is not part of teaching about the medication silver sulfadiazine.
A client with major depressive disorder has independently showered, dressed, and washed her hair for the first time since her admission to the inpatient unit 4 days ago. In an interaction with the nurse, she still stresses her faults. She states, "I'm just no good. I can't do anything right." The nurse's best response would be 1. You look very nice today. 2. You were able to shower, wash your hair, and dress today. 3. I'll get out the craft project that you wanted to complete. 4. What is your goal for today? The correct answer is 2. You were able to shower, wash your hair, and dress today. Rationale. An objective reflection by the nurse based on actual behavior is the best affirmation for the client to help boost self-esteem. Depressed persons tend to reject positive opinions from others. Picking a project for such a client is also likely to bring a negative response and/or foster dependence. Antipsychotics are sometimes prescribed for clients with bipolar disorder and would not pose a special concern.
An older patient had ranibizumab injected into his eye for treatment of wet, age-related macular degeneration several days ago. He is now experiencing redness, light sensitivity, and pain. Which advice would the nurse give to the patient? 1. These are common side effects that should pass after a few more days. 2. Contact the healthcare provider immediately for possible eye infection. 3. Rest eyes as much as possible and wear sunglasses if lights are too bright. 4. Inform the HCP before the next treatment so that the dosage can be adjusted. The correct answer is 2. Contact the healthcare provider immediately for possible eye infection. Ranibizumab is an angiogenesis inhibitor that is directly injected into the vitreous humor of the eye. The purpose of the medication injection is to inhibit the growth of new blood vessels in patients who have neovascular age-related macular degeneration. The biggest concern about adverse effects of the treatment is endophthalmitis. This can be caused by bacteria, virus, or fungus. Redness, light sensitivity, or pain are signs of possible endophthalmitis that should be immediately reported to the provider. A client has peripheral vascular disease of the lower extremities. The client tells the nurse, "I've really tried to manage my condition well." Which of the following routines should the nurse evaluate as having been appropriate for this client? 1. Resting with the legs elevated above the level of the heart. 2. Walking slowly but steadily for 30 minutes twice a day. 3. Minimizing activity. 4. Wearing anti-embolism stockings at all times when out of bed. The correct answer is 2. Walking slowly but steadily for 30 minutes twice a day. Slow, steady walking is a recommended activity for clients with peripheral vascular disease because it stimulates the development of collateral circulation. The client with PVD should not remain inactive. Elevating the legs above the heart or wearing anti-embolism stockings is a strategy for alleviating venous congestion and may worsen peripheral arterial disease. When preparing discharge instructions for a client after an abdominal hysterectomy, the nurse should first 1. Have the client watch an educational video. 2. Assess the client's available social supports. 3. Call the social worker to evaluate the client. 4. Read the discharge instructions to the client. The correct answer is 2. Assess the client's available social supports. Assessment is the first step in planning client education. Assessing social support resources is a key aspect of discharge planning that begins when the client is admitted to the hospital. It is imperative to know what assistance and support the client has at home. Assessment includes obtaining data about any family or home responsibilities the client is concerned with during the recovery period. It is within the scope of nursing practice to provide discharge instructions. A social worker is not needed at this time. The nurse should assess the client's needs before determining whether using a video or reading instructions to the client is appropriate. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse should instruct a client who has been diagnosed with vasospastic disorder, Rationale's phenomenon, to 1. Immerse the hands in cold water during an episode. 2. Wear light garments when the temperature gets below 50 degrees Fahrenheit. 3. Wear gloves when handling ice or frozen foods. 4. Live in a cold climate. The correct answer is 3. Extreme changes in temperature can precipitate a vasospastic episode and should be avoided by clients with vasospastic disorder, Raynaud's disease. The client should be encouraged to wear gloves when handling frozen foods or ice. The client should immerse the involved extremity in warm water during an episode to promote vasodilation and relaxation of the small arteries that are in spasm. The client can help prevent vasospasm brought on by temperature changes by wearing warm clothes. Living in a cold climate will exacerbate the symptoms. When receiving discharge instructions, a patient with osteoporosis makes all of these statements. Which statement indicates to the nurse that the patient needs additional teaching? 1. I take my ibuprofen every morning as soon as I get up. 2. My daughter removed all of the throw rugs in my home. 3. My husband helps me every afternoon with range of motion exercises. 4. I rest in my reclining chair every day for at least an hour. The correct answer is 1. I take my ibuprofen every morning as soon as I get up. Rationale. Ibuprofen can cause abdominal discomfort or pain and ulceration of the gastrointestinal tract. In such cases, it should be taken with meals or milk. Removal of throw rugs helps prevent falls. Range of motion exercises and rest are important strategies for coping with osteoporosis.
The client is reporting severe chest pain radiating down the left arm and is nauseated and diaphoretic. The HCP suspects the client is having an MI and has ordered morphine sulfate for the pain. Which interventions should the nurse implement? Select all that apply. 1. Instruct the client not to get out of the bed without notifying the nurse. 2. Administer the morphine sulfate intramuscularly in the ventral gluteal muscle. 3. Dilute the morphine sulfate to a 10 milliliters bolus with normal saline. 4. Administer the morphine sulfate slowly over 5 minutes. 5. Question the order because morphine sulfate should not be administered to a client with an MI. The correct answers are 1. Instruct the client not to get out of the bed without notifying the nurse. 3. Dilute the morphine sulfate to a 10 milliliters bolus with normal saline. And 4. Administer the morphine sulfate slowly over 5 minutes. The client should not get out of the bed without assistance due to the drowsiness the client will experience after receiving morphine sulfate, a narcotic analgesic. Also, the client is having chest pain and should not get out of bed without assistance. Morphine sulfate, a narcotic analgesic, is the drug of choice for chest pain, and it is administered intravenously so that it acts as soon as possible, within 10 to 15 minutes. IVP medications should be diluted to help decrease the pain when it is administered and to prevent irritation to the vein. Morphine sulfate may be administered intravenously when a rapid onset of action is desired. The dose is usually in the range of 2.5 to 15 milligrams, given slowly over 4 to 5 minutes. The pregnant client is prescribed metoclopramide to treat hyperemesis gravidarum. Which information should the nurse discuss with the client? Select all that apply. 1. Chew the tablet thoroughly before swallowing. 2. Take the medication 30 minutes prior to mealtime. 3. Do not drink any type of alcoholic beverages. 4. Muscle spasms are a common side effect. 5. The medication can cause drowsiness that will make driving unsafe. The correct answers are 2. Take the medication 30 minutes prior to mealtime. 3. Do not drink any type of alcoholic beverages. And 5. The medication can cause drowsiness that will make driving unsafe. The medication should be taken on an empty stomach at least 30 minutes before eating. Alcohol can increase central nervous system depressive symptoms of the medication and should be avoided. Metoclopramide can cause drowsiness. The client should avoid driving until the response to medication is known. The client should swallow the medication. The client should not crush, chew, or suck on the medication. Muscle spasms and rigidity are extrapyramidal side effects and should be reported to the HCP. The client diagnosed with tonsillitis is scheduled to have surgery in the morning. Which assessment data should the nurse notify the healthcare provider about prior to surgery? 1. The client has a hemoglobin of 12.2 grams per deciliter and hematocrit of 36.5%. 2. The client has an oral temperature of 100.2 degrees Fahrenheit and a dry cough. 3. There are 1 to 2 white blood cells in the urinalysis. 4. The client's current international normalized ratio is 1.0. The correct answer is 2. The client has an oral temperature of 100.2 degrees Fahrenheit and a dry cough. A low-grade temperature and a cough could indicate the presence of an infection, in which case the healthcare provider would not want to subject the client to anesthesia and the possibility of further complications. The surgery would be postponed. The hemoglobin and hematocrit given are within normal range. This would not warrant notifying the healthcare provider. 1 to 2 WBCs in a urinalysis is not uncommon because of the normal flora in the bladder. The INR indicates that the client's bleeding time is within normal range. In this question, all the answer options contain normal data except for one. The nurse would not call the healthcare provider to notify him or her of normal values. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Which client is at greatest risk for coronary artery disease? 1. A 32-year-old female with mitral valve prolapse who quit smoking 10 years ago. 2. A 43-year-old male with a family history of CAD and cholesterol level of 158. 3. A 56-year-old male with an HDL of 60 who takes atorvastatin. 4. A 65-year-old female who is obese with an LDL of 188. The correct answer is for a 65-year-old female who is obese with an LDL of 188. Rationale. The woman who is 65 years old, overweight, and has an elevated LDL is at greatest risk. The combination of postmenopausal obesity and high LDL places this client at greatest risk.
A 32-year-old patient with sickle cell anemia is admitted to the hospital during a sickle cell crisis. Blood pressure is 104/62, oxygen saturation is 85%, and the patient reports pain at a level 8. Which action prescribed by the healthcare provider will the nurse implement first? 1. Administer morphine sulfate 4 to 8 milligrams IV. 2. Give oxygen at 4 liters per minute via nasal cannula. 3. Start an infusion of normal saline at 200 ml per hour. 4. Apply warm packs to painful joints. The correct answer is 2. Give oxygen at 4 liters per minute via nasal cannula. National guidelines for sickle cell crisis indicate that oxygen should be administered if the oxygen saturation is less than 95%. Hypoxia and deoxygenation of the blood cells are the most common cause of sickling, so administration of oxygen is the priority intervention here. Pain control and hydration are also important interventions for this patient and should be accomplished rapidly. A client who is in a motor vehicle accident has a fractured mandible. Surgery has been performed to immobilize the injury by wiring the jaw. In the immediate post-operative phase, the nurse should 1. Prevent nausea and vomiting. 2. Maintain a patent airway. 3. Provide frequent oral hygiene. 4. Establish a way for the client to communicate. The correct answer is 2. Maintain a patent airway. The priority of care in the immediate post-operative phase is to maintain a patent airway. The nurse should observe the client carefully for signs of respiratory distress. If the client becomes nauseated, antiemetics should be administered to decrease the chance of vomiting with obstruction of the airway and aspiration of vomitus. Providing frequent oral hygiene and an alternative means of communication are important aspects of nursing care, but maintaining a patent airway is most important. While changing the client's colostomy bag and dressing, the nurse assesses that the client is ready to participate in self-care by noting which of the following. 1. The client asks what time the doctor will visit that day. 2. The client asks about the supplies used during the dressing change. 3. The client talks about the news on the television. 4. The client is upset about the way the night nurse changed the dressing. The correct answer is 2. The client asks about the supplies used during the dressing change. A client who displays interest in the procedure and asks about supplies used for dressings may be ready to participate in self-care. Inquiring about the physician's visit, discussing news events, and discussing a dressing change are behaviors that avoid the subject of the colostomy.
The nurse should instruct a young female adult with sickle cell anemia to do which of the following? Select all that apply. 1. Drink plenty of fluids when outside in hot weather. 2. Avoid being in high altitudes. 3. Be aware that since she is homozygous for hemoglobin S, she carries the sickle cell trait. 4. Know that pregnancy with sickle cell disease increases the risk of a crisis. 5. Avoid flying on commercial airlines. The correct answers are 1, 2, and 4. The nurse should teach the client to drink plenty of fluids to avoid becoming dehydrated. The client should avoid being in high altitudes, such as mountains above 5,000 feet, where there is less oxygen in the air, which may precipitate a sickle cell crisis. The nurse should alert young women with sickle cell anemia that pregnancy increases the risk of a crisis. People who are homozygous for hemoglobin S have sickle cell anemia. The heterozygous form is the sickle cell carrier trait. A client with sickle cell anemia may fly on commercial airlines. The airplane is pressurized and has an adequate oxygen level.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is caring for a postoperative patient with a hip replacement. Which patient care actions can be delegated to the experienced assistive personnel? Select all that apply. 1. Inspect heels and other bony prominences every 8 hours. 2. turn and reposition the patient every 2 hours. 3. Ensure that the patient's heels are elevated off the bed. 4. Assess the patient's calf regions for redness and swelling. 5. Check vital signs and oxygen saturation via pulse oximetry. 6. Assess for pain and administer pain medication. The correct answers are 2. Turn and reposition the patient every 2 hours. 3. Ensure that the patient's heels are elevated off the bed. And 5. Check vital signs and oxygen saturation via pulse oximetry. Rationale. The AP scope of practice includes repositioning patients and checking vital signs, and an experienced AP would know how to check pulse oximetry and elevate the patient's heels off the bed. Assessing and inspecting patients is more appropriate to the educational level of the professional nurse.
The client with coronary artery disease is prescribed cholestyramine. Which intervention should the nurse implement when administering the medication? 1. Administer the medication with fruit juice. 2. Instruct the client to decrease fiber when taking the medication. 3. Monitor the cholesterol level before giving medication. 4. Assess the client for upper abdominal discomfort. The correct answer is 1. Administer the medication with fruit juice. Cholestyramine is a bile acid sequestrant. This medication should be administered with water, fruit juice, soup, or pulpy fruit such as pineapple to reduce the risk of esophageal irritation. The client in labor has an epidural catheter in place for anesthesia. Which intervention is most important for the labor and delivery nurse? 1. Assist the client with breathing exercises during contractions. 2. Ensure the client's legs are correctly positioned in the stirrups. 3. Have the significant other scrub for the delivery of the baby. 4. Titrate the epidural medication to ensure analgesic effect. The correct answer is 2. Ensure the client's legs are correctly positioned in the stirrups. Because the legs are numb as a result of the epidural, the nurse must ensure the legs are in the stirrups correctly so that the client will not experience neurovascular compromise or any type of injury to the legs when they are in the stirrups. Breathing exercises are important, but the protection of the client's lower extremities while under anesthesia should be a priority for the nurse. Preparing the significant other for the delivery is important, but it is not a priority over the safety of the mother's lower extremities. The anesthesiologist or nurse anesthetist would be responsible for administering the anesthesia during the delivery. The nurse in a long-term care facility is planning the care for a client with a percutaneous endoscopic gastrostomy feeding tube. Which intervention should the nurse include in the plan of care? 1. Inspect the insertion line at the nares prior to instilling formula. 2. Elevate the head of the bed after feeding the client. 3. Place the client in the Sims position following each feeding. 4. Change the dressing on the feeding tube every 3 days. The correct answer is 2. Elevate the head of the bed after feeding the client. Elevating the head of the bed uses gravity to keep the formula in the gastric cavity and help prevent it from refluxing into the esophagus, which predisposes the client to aspiration. A gastrostomy tube is placed directly into the stomach through the abdominal wall. The nares is the opening of the nostril. The Sims position is the left lateral side-lying flat position. This position is used for administering enemas and can be used to prevent aspiration in clients sedated by anesthesia. The sedated client would not have a full stomach. Dressings on PEG tubes should be changed at least daily. If there is no dressing, the insertion site is still assessed daily.
Which of the following comments indicates that a client understands the nurse's teaching about sertraline? 1. Zoloft will probably cause me to gain weight. 2. This medicine can cause decreased libido. 3. Dry mouth is a permanent side effect of Zoloft. 4. I can take my medicine with St. John's wort. The correct answer is 2. This medicine can cause decreased libido. Rationale. Sertraline, like other selective serotonin reuptake inhibitors, SSRIs, can cause decreased libido. SSRIs do not typically cause weight gain, but may cause loss of appetite and weight loss. Dry mouth is a possible side effect, but it is temporary. The client should be told to take sips of water, suck on ice chips, or use sugarless gum or candy. St. John's wort should not be taken with SSRIs because a severe reaction could occur.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.